With the number of COVID-19 cases at a manageable level in Wales, the Welsh Government have outlined a new coronavirus control plan in the event of cases rising once again. With coronavirus cases expected to rise in the autumn and winter, the plan outlines 5 key levels of intervention. The first, prevention. Of course, the most effective way of combating COVID-19 is stopping it from spreading in the first place. Until a vaccine is found, the report states that we must all play our part by washing hands and following social distancing guidelines. The second, new cases and clusters. When they arise, the test, trace, protect teams across Wales contact those who have been tested positive and tell them to self-isolate along with their close contacts. The current law states that public health officers can order people to attend testing programs, provide contact tracing information, and tell them to self-isolate for up to 14 days. Number 3, incidents and outbreaks. If the virus is not contained, an outbreak may be declared. If this happens, a multi-agency outbreak control team is established. Local action could take place, such as the closing of a premises, closing public land, or the stopping of events in a given area. The fourth intervention is something which we have so far avoided here in Wales. Local or regional lockdown. Health Minister Vaughan Gething said this may be because an outbreak associated with a particular setting has led to wider community transmission, or there are a series of outbreaks that require a more substantive response. The fifth and final approach in the Welsh Government's coronavirus control plan is an all-Wales lockdown. This, of course, has already taken place, yet the report claims that we would be much better prepared for this outcome a second time round. We are also learning a lot from nations abroad in regards to how they are minimising the harms another lockdown could bring. For now, though, the latest cases on Tuesday were no new deaths and 24 new cases. But for how long this will last is another question altogether.